Hello everyone, welcome to my channel Capsa. Today's topic is on dynamics, okay? Actually proper not dynamics. We will learn today about the important terminologies which are used in dynamics, like what is agonist, what is antagonist, what do you mean by drug, what are receptors, what do you understand by ligands. Because if you don't have the clear concept on this kind of terminologies, you will never be able to understand the receptor drug mechanism based on dynamics, okay, pharmacodynamics. So let's start. So today's topic actually the terminologies used in pharmacodynamics. Or you can say these are the definitions, okay? Okay. Then we will go what are the factors affecting drug action, what are the type of receptor, step by step, okay? So it's the first part of pharmacodynamics. Now, what do you understand by the word pharmacodynamics? It actually comes from a Greek word. First one is pharmakon, that means drug, and dynamikos mean power or the power of drug which is acts on your body, okay? It means mechanism or mode of action of drug we will understand. So what we will understand here? Mechanism or mode of action of drug. Okay. We know that drugs can induce a tissue response through two types of mechanism. It can be receptor mediated or non-receptor mediated. So drugs can induce a response and it can be receptor mediated and non-receptor mediated. Receptor mediated means in this type of mechanism, receptors are involved, but non-receptor mediated means here receptor is not involved or directly involved. So I have used the term like drugs. What do you understand by drugs? So we will understand what do you understand by drugs. It actually comes from a French word that means drug, means dry herb. Now we will understand pharmaceutical, okay? We know medicine equal to, do not write like this, okay? I am just to make you understand, I am writing like this. Medicine is active pharmaceutical ingredient plus excipients. Okay. Now, active pharmaceutical ingredient, I can say if we eliminate the excipients from medicines, the remaining part will be active pharmaceutical ingredient or it can be denoting as drugs. Okay. So, what are the active pharmaceutical ingredients that are actually drugs? Okay. Now, I have used the term what is receptor. Okay. So, we will understand about receptors. These are specific cellular macromolecules. What kind of macromolecules? Proteins that interact with a ligand by binding to produce a response. So, what I have said that these are macromolecules after binding with the ligand can produce a response. Clear? Actually, pharmacologically, 4 types of receptors are present. Okay, so receptors are 4 types. First one is nuclear receptor. Second one is enzyme linked receptors, and the third one is what important thing, that is G protein coupled receptor. And the last, fourth one is remaining ligand gated ion channel receptors. We will understand individual receptor, their mechanism, their function, everything in another lecture, step by step. Okay. Now I have used the term that ligand. You need to be clear about what is ligand. So, what is ligand? What do you understand by ligand? Actually, ligands are 2 types, kind of binding molecule. Okay, these are agonist or it can be antagonist. These are known as ligands. So, first one is agonist. I am using another color that will make you easy to understand. So, first one is agonist. Now, what is agonist? What do you understand? These are the kind of drugs that capable of binding to a receptor and can activate a receptor and can produce a therapeutic response. Okay. So, these are the drugs that capable of binding to the receptor and can produce response. Obviously, therapeutic response. Now, this agonist again subdivided into 3 categories. First one is partial agonist. What do you understand by partial agonist? Actually, these are the drugs that occupy receptors but cannot elicit or produce a maximum response. Okay. So, these are the drugs that occupy receptor but cannot produce a maximum response. That's why its intrinsic activity is denoting as less than 1. Okay. Now, the next one is another type of agonist is full agonist. Now, what is full agonist? It are the drugs that occupy receptors to cause a maximum activation or maximum response. Okay. So full agonists are drugs that occupy receptors to produce maximal response. It means full agonist, after binding or occupying the receptor, whole receptor, it can produce maximum amount of response, okay, maximum effect. But partial agonist, after binding with the receptor, occupying the receptor, it can produce less amount of effect, okay. Now another term is, and its intrinsic activity is counted as 1, okay. This intrinsic activity is the part of MCQ which are asked, okay. Another one is the third one, that is inverse agonist. Okay, now we will understand what is inverse agonist. These are the drugs that produces response opposite to the pharmacological effect of agonist. Okay, so it produces the opposite effect which are produced by the agonist. So these are the drugs after binding to the receptor produces opposite response of the agonist. So its intrinsic activity is counted as negative value. It can be less than or it can be more than 1. Okay. Now I have used the term intrinsic activity. So we need to understand what is intrinsic activity. Now we will understand what is intrinsic activity. I need to take another color. Intrinsic activity is used to indicate actually efficacy. We will understand later, okay? And actually it is the ability of a drug to activate receptor once it has bound to it. It means after binding to the receptor, how much the ability of drug which can produce the effect, okay? So it's a ability of drug to activate receptor once it has bound to it. Clear? Now we will understand what is antagonist. Antagonists are the drugs when they bind to the receptor do not produce or initiate a response, but they block the action of an agonist that works through that receptor. What I have said, when this kind of drugs bind to the receptor, do not produce or initiate a response, but they block the action of an agonist that works through that receptor. Okay, so these are the drugs that bind to receptor but do not produce a response. Okay, and blocks the action of agonist. Clear to you? Now, these antagonists are of two types. Okay. First one is competitive antagonist. Second one is non-competitive antagonist. Okay. So, first is competitive antagonist. What is competitive antagonist? The name suggests that obviously it will compete with the agonist for the same recognition site of the receptor. Okay. And what is non-competitive antagonist? It means it obviously prevents the binding of an agonist or prevent the activation of the receptor by the agonist. Okay. So, competitive antagonists are competes with agonist for the same recognition site of receptors. But non-competitive antagonists do not compete with the agonist, but they block the activity of agonist, okay, or prevents the binding of an agonist or prevent the activation of receptor by the agonist. Okay. Now, we need to clear the concept about non-competitive antagonists, that how they do so, how they prevent the binding. Actually, how they do, because these non-competitive antagonists binds irreversibly to the recognition site of the receptor. They itself bind to the receptor irreversibly, or it can bind to another site that is known as allosteric site of the receptor. Clear? So, non-competitive antagonist can bind irreversibly to the recognition site of the receptor and blocks the binding of an agonist. Okay, or it can prevent the activation of receptor by binding with the allosteric site of the receptor. Okay. Now, if the ligand takes part in non-receptor mediated action, I have previously told that drugs can produce response by two types of mechanism. One can be receptor mediated, another one can be non-receptor mediated. In the receptor mediated, these things are come like ligands, agonist, antagonist, these things. If there is a ligand that takes part in non-receptor mediated action, how they will act? Actually, they can be act chemically, okay, with agonist by staying away from the receptor. They obviously interact with the agonist, but by staying away from the receptor. Or it can be physiologically by acting on the different receptor to induce the opposite action, or it can activate enzyme. So, how it can mediate? If the ligand takes part in non-receptor mediated action, how they will act? Okay, they first act by interacting chemically with whom? Obviously with the agonist, okay, by staying away from the receptor, or it can be physiologically acting on different receptor. So, after acting on different receptor, and which can induce or opposite the action of agonist, okay, or it can act through, inhibit or activate another enzyme, etc. Okay, so these are the non-receptor mediated action, means here directly receptors are not involved. Clear? Now we need to clear about three terminologies remaining. First one is affinity. Okay, so what do you understand by affinity? Actually, it is the ability of a drug to bind to a receptor, or we can say like how well a drug and a receptor can recognize each other. What I have said, the ability of a drug to bind to a receptor, or how well a drug and a receptor can recognize each other. Okay, so it's the ability of a drug to bind to a receptor. Clear? Another one is potency. So what do you understand by potency? It is the relative doses of agonist to produce the magnitude or maximum of a response, or we can say the quantity of drug required to achieve a desired effect. Okay, so it can say like relative doses of agonist to produce the maximum response. Okay, it's the ability, it is the dose. Now we will understand the efficacy of a drug. Efficacy actually a measure of how well a drug produces a response, or we can say it is the maximal effect an agonist can achieve at the highest practical concentration. So we can say that a measure of how well a drug can produce a response, and it is maximum or it can be minimum, that is denoted by intrinsic activity. Or IA. Clear to you? So this is the end of my lecture. If you like my video, please do like, comment, share and subscribe. And the latter part of pharmacodynamics we will understand in the next lecture. Okay. Thank you for your attention.